There's two sides to every coin. On one side, it's a challenge. On the other side, it's an opportunity.
Change in healthcare is coming if you haven't already seen it, and you have an option.
There is a huge gap in how EMS has been evaluated, what their perceived value is into the healthcare space, and that there was a lot of impact to be made on closing the gap. It took some innovators that said, this is kind of crazy. Let's try a new partnership.
Change is coming, whether you like it or not. Everybody adapts to change differently. Well, welcome everyone to another episode of the Leadership Lab. And this time I'm just so excited that Dr. Victoria Reinhartz is with me today. So Dr. Victoria, welcome to the Leadership Lab.
Thank you so much for having me. This is overdue. I was excited to join you today.
Absolutely. And there's so much now happening in the mobile integrated health space. I know many things, and we're going to get into our conversation about so much that has happened in this space, specifically literally in the last several months. But there's a lot of work that you've been doing personally in this space. So I want to introduce our audience to you because some may know who you are and some may not. So I don't like to make any assumptions, as you know. And so I think it's really, really important for people to know who you are. And so, Dr. Victoria, I'm going to probably call you Victoria if that's okay, because it just makes it easier. But if you can introduce yourself to the audience, who you are, from your personal background, then I want to we're going to dialogue a little bit about what you're doing more on a national level, which is very impactful to the mobile health industry.
Yeah, I am happy to introduce myself a little bit if you're not familiar, if we have a listener that I have not yet had the pleasure of meeting, because I'm a transplant in the EMS space. I wasn't somebody that grew up with EMS in my blood, and my experience in healthcare and background is more in chronic disease management and transitions of care and the intersection of that with public health. And really, I got kind of snowballed into EMS directly through mobile integrated healthcare, or MIH and Community Paramedicine, because like all good things or all new journeys, I got asked for a favor. So I was in 2015, I was teaching at a College of Medicine and School of Pharmacy. And I was asked by the county to give some advice because they were trying to start an MIH CP program. And they wanted to really make sure that those with complex needs and uncontrolled chronic diseases intersecting with public health need and social drivers of health were captured within that program priority. And so I was nudged for a favor. And fast forward, 30 days later, I'm embedded in a mobile integrated health program as one of the clinical consult teams for chronic disease management. And it took some innovators that said, this is kind of crazy. Let's try a new partnership. And Asbel, 4 years later, we find ourselves doing a cost-effective analysis from the lens of a payer view to really find that we were wildly effective. And that was that. There was no turning back. I fell in love with the concept of how underutilized EMS professionals are and how useful they can be in solving some of our healthcare outcomes challenges. And we have a lot of that on the horizon still. And so, my professional mission kind of changed, and I pivoted full force into mobile integrated health and community paramedicine, and have had the pleasure of serving in a couple different roles nationally, whether it's helping programs to develop or traveling across the country to help grow the board-certified community paramedic workforce, and then was wonderfully invited to help found the National Association of Mobile Integrated Healthcare Providers, and have been able to serve in that capacity as executive director now for the last 2 years.
So we're going to pivot to that. But before I do that, you made just a statement right now that I've actually heard resonated for several years now. And even more notably, as we continue to talk about that, is that you came and you were kind of a transplant into EMS. But you just indicated, when I got in there, I just saw how underutilized EMS is. And I'm going to paraphrase, in the healthcare continuum.
Mm-hmm.
And that is just a very a general thing that you're hearing. So I know we're going away from script a little bit because, of course, you have to have outlines to follow through the
Yeah.
process. But tell me what your reaction of that when you came in there and you had that aha moment to say, you know what, they're underutilized. And this started this journey to where you became one of the founders of this association that we're going to talk a little bit about because I really want to bring that to the forefront, especially because I think you guys are really in a prime position to do some yeoman's work around this space.
Yeah, I think for me, it all boiled down to perspective. The way that I was looking at healthcare outcomes, healthcare access, and what the utilization and clinical goals were for my patient population, it differed pretty significantly to what we know has, been the long-standing measurement of EMS success, so to speak. And I just felt that at the forefront of my day to day when I got embedded within an MIH and CP team, that there is a huge gap in how EMS has been evaluated, what their perceived value is into the healthcare space, and that, there was a lot of impact to be made on closing the gap or where EMS is over here and the healthcare lens, the rest of the world's view is over here. We can close that gap and really help to highlight how EMS professionals are just such an incredible tool. And so, yeah, a lot of exciting things happening, now through the association, and it's been wonderful to help, figure out what projects and what initiatives can speak to that value and work to really change on a national scale how MIH and CP is evaluated and how we show the value of that in EMS as well.
Well, my hat goes out to you specifically because you came into this industry and then you took the leap into starting an association and corralling a lot of people with a lot of different ideas, a lot of different
Mm-hmm.
scopes, a lot of different personalities together to put together toward a singular mission. So, number one, thank you. I know I've just met you for a few years now, probably 5 or 6 years that we've gotten to know each other. And it's just been a pleasure. It's been a pleasure as we continue to elevate as an industry that more and more individuals like you are taking an interest into some of us that have these as our passion projects. I've been in EMS for 30 years, but more from the healthcare finance space. So really glad to have this discussion with you. It's long overdue and glad that we're having it now because I really feel like we still have this very short window again that we could
Yes.
really make an impact in the healthcare continuum. So let's talk about the National Association of Mobile Integrated Healthcare Providers. There are some people that might think they know what it is. I thought I knew what it was. I remember when it was starting. I remember getting a phone call. I don't know if it was from Dixon at the time or it may have been Chris Kelly.
Mm-hmm.
It was someone that was a part of the founding group. And I knew at the time I was so busy doing some other things, I couldn't get involved at that entry level stage. But talk to me about the vision behind it. You guys have grown pretty rapidly. It's an amazing
Mm-hmm.
organization that's really doing some yeoman's work around mobile integrated health. And it's really taken off. Specifically, I've really seen a major increase in membership over the last few years. But talk to me
Mm-hmm.
about the vision around that and what was the vision around starting this association?
Well, and it's interesting that you said Dixon. And if you're listening to this and you don't know who Dixon is, Dixon Marlowe is really, the founding partner for the association and really making sure that we were able to form those initial connections from a national scale and work with that initial core group to get us going. And we started as an organization recognizing that so many of our other national peer associations had started great work in the MIH and CP space, but there are too many things to do across the EMS space. And everybody has a mission and a focus and so many other prominent issues just in emergency medical response that are at the forefront of their day-to-day work, that we knew there needed to be a national association that could support and augment all of our peer partners in the EMS space at the national level to own MIH and CP growth, network, projects, initiatives, and support the work that is already being done without adding to the burden of our peer partners in this space. And that was, really how we started to develop our core mission, our core tenets of what we're going to, focus on as our principles on a regular basis, and what types of projects we wanted to focus on at start.
So let's talk about those core tenets, because you're speaking my language when you talk about this, because jack of all trades, master of none. I do like it, and the associations are so prominent. We need them, especially with as large as our industry is, but I like it. It's like medicine. You have a family doctor, but if I need something cardiac related, I'm probably going to go to more of a cardiovascular surgeon. I'm going to go maybe talk to a neurosurgeon if I have something with so I'm going to look at various specialties. And so I see you guys as a specialty. And so talk to me about those tenets around what this association looks like to augment some of the other associations, specifically as it deals with the mobile integrated health space.
Yeah. So, the first and foremost, tenet or principle that drives us is probably empowerment. And we take it very seriously that we stand on a daily basis, that we are mission driven in our membership. And we take our duty, or consider it a duty, to really be the national voice of what MIH and CP is doing across the nation, and making sure that we're empowering everybody that is either starting this work out from scratch, or, working to expand it or branch into a new space, to, empower them in being able to do that more effectively. And we know as well that our peer organizations and associations, will also benefit from that support of our collaborative empowerment of the capabilities of EMS professionals in the MIH and CP space. And so, yes, empowerment is absolutely something that we have focused on. We have done that in a couple different ways. We have, partnered with NAEMT to develop the CP of the Year, which is getting announced here very soon, and certainly will be celebrated as well this year at EMS World. We have, partnered to highlight at each of our events a spotlight program that has had successes in the payer realm or in partnership with providers or other innovative approaches to launch MIH and CP to the next level. And, even if you just look over the last 3 or so years, our association, in a small but mighty show of empowerment across this space, just our group has probably had over 400 different presentations in the MIH and CP realm to highlight different models, how this can be implemented, the value of these programs in healthcare, et cetera. So we have taken that mission of empowerment, or that core principle, and really tried to make sure that it is implemented in our key projects and initiatives.
Now, do you guys have like state chapters, or is this just mainly like a national association at this point?
Right. Great question. Right now, we are national. We do not have state chapters at this point. We have a couple states that are going to duke it out, we think, when we go to do that. So that's going to be interesting to see how it develops. And we have gone back and forth about, launching state chapters. But one of the challenges that we wanted to be really careful about is not getting too diluted And we recognize that in this space and time, that staying strong as one national voice is really going to help us in a big picture standpoint. And, I think that you asked me about the core principles. The other two that I would say that are prominent here and relate to that question that you just asked about the state chapters or how we kind of split or arrange our membership nationally. Collaboration is probably another key piece, and agility is another key piece. And we have really stood strong in our devotion to foster growth and foster partnerships. And if we're, creating a system there that's disjointed, that doesn't do service to individual groups that are, going one state to the next, or trying to make sure that they're having as big of an impact as possible. And so, we've recognized that the collaboration principle that we have in fostering growth and fostering partnership, we're really stronger as one national voice, and we continue to stand pretty firm in that and anticipate that for a little while longer. And then, the other aspect, of course, is agility. We're very action oriented. And, we have a bias towards action, almost to that point where sometimes you hear that analogy that EMS is the Swiss Army knife. EMS can come in and do anything across the board, whether it's natural disaster or a pandemic or, crisis of the day. EMS is the Swiss Army knife that you can deploy. And we recognize that as one strong national group, that we can pull from a network that is very dialed in. And we have the ability to be agile for our partners and for, things at an individual state level if we need to be. And we're able to really hone in on a specific goal. And you talked, Asbel, just a moment ago about our growth and how much we have grown. And you're spot on, right? Because we maintained this focus of a national powerhouse being a goal. We have been able to, set a goal of membership growth to hit a certain threshold, and turn around and 2 years later we're 380 agencies and organizations deep, for example. So it has been intentional, at least up to this point, to stay a big national voice.
And I know just by watching and seeing what's happened, and that's why I commented on it, because people join something that they feel that there's value, but then you must sustain that value. And that's kind of why we're having this conversation, Victoria, as well, because as I've been saying, which I like, the Swiss Army knife analogy as well. I know people have been talking about that. One of my great friends, Jamie Pafford, who's the president of the American Ambulance Association, really has used that in her tenure as president as a Swiss Army knife concept. But I also wanted to talk about from the mobile integrated health and that continued value moving forward and the future of mobile health. Is we're looking at this on through the national lens right now. And there's a lot going on. And we're going to get to this rural health transformation program because it is all the buzz in the EMS industry, as it should be, because we worked hard on that. It's moving very, 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 very rapidly. But we have another opportunity, and it is nationally recognized at the Centers for Medicare and Medicaid Services and Health and Human Services, how EMS can actually bend the cost curve and provide transformational care in rural America. But we've been doing this for a while anecdotally. Some have said this has been happening, Asbel, for years and years. It was happening overseas. But as Americans, sometimes, specifically in this environment right now, there's a lot of America First concepts. And we like to think we do things better than everyone else does. And so let's talk through some of those concepts and what you see as the national director in an organization that is adapting and innovating. You guys are very innovative at this point in time, and that's kind of my mantra right now. You can adapt and innovate, or you can protect and preserve. You're going to get a different outcome based upon the way that you look at it. I'm an adapt and innovate guy. And so talk to me about what you see like in the next 18 months. what you see that we can take advantage of, especially with what we see happening very quickly, even within this new administration and this new Congress and healthcare in general?
Mm-hmm.
It's a loaded
It's a great
question, I know.
question. It is. It is a loaded question, but it's a good question because we're all in this boat together, right? And we're all going to have to navigate what the next 18 months to 2 years to 5 years is going to look like here. And I will tell you that there's two sides to every coin. On one side, it's a challenge. On the other side, it's an opportunity. And, they're really specifically over the next 18 months, I anticipate those to look very similar. And one of the aspects that we have recognized has to be front and center and has historically been a challenge in the EMS space is making sure that we are guided by the data that is available and that we're keeping that at a forefront of what our decisions are and where our focuses are. In healthcare, we don't just go provide care services based on our gut feeling, right? When we find out that there's new evidence on impact and better outcomes, then we follow that concept of evidence-based medicine. And mobile integrated health and community paramedicine really has to be the same. And so we have started to make significant efforts in a national scale to dial in on what the data actually says and be informed through that data lens with how and where we can have the best impact for mobile integrated health, for community paramedicine, for EMS as a whole. And the other piece of that is that we also have to get better at our own, storytelling. And we have highlighted in the past where MIH and CP has struggled or, what the challenges are with funding models and inconsistency one state to the next. But it's time to really, again, flip that challenge to an opportunity. And that's one of the things that we have been focused on is how do we support our partners in this space in getting the data available, ensuring that we have data sets on a national scale that highlight the magnitude of impact, the population size and scope that we are able to touch and hit across the country, and matching that with the storytelling that really highlights the impact of these programs. So that's where I see us focusing over the next 18 months, and that if you're not dialed in or thinking about those pieces, it's time to be, and we can certainly, help you make sure that you have a voice and a place in getting to that level of making sure this is a focus for you.
And I love that. I love you're speaking my language. Outcome data. We've been talking about that. I really strongly believe and have believed, and I really believe that is one of the reasons why we were able to we're gonna kind of segue into the rural health transformation program, because that is on everybody's mind, and there's a deadline that states are working towards in early November around that. But outcome data is important. And on the Leadership Lab, I've had 2 discussions already. My inaugural podcast was with Dr. Beck with ESO, who has almost 50% of the data set around longitudinal data and outcome data relative to EMS that is linked to a hospital record. And then my latest episode, right before this episode, we also brought out another thing where we actually took another step 2 towards the process of really understanding that. And I know that other large data companies in EMS as well are beginning to really understand that outcome data piece. And it's really, really important. Anecdotal data gets us only so far. It's on the national level, we have got to have more outcome data. And so I really am strongly, the clinicians such as you and others and the data companies are going to lead this, and that's a part of the storytelling. And so we're so excited that we're in these positions and we're looking at it and we're looking at how to tell our story better from the local level. Let's talk about the Rural Health Transformation Program. I know that your phone's probably been ringing off the hook. Everybody's been out. I know my phone's been ringing off, and I'm not really doing a lot outside of having these conversations with it. Like, what can we do? And I've tried to assist, but I know because this is I mean, it's out of the box. It's mobile health. It's how do we help people outside of transit?
Mhm.
Everything that we've been talking about
Mhm.
for the last 20, 25 years. Others in the industry have been talking about it. So I can only imagine what you guys are doing, working on, trying to provide information to your members, to the community at large, what to expect. So let's just kind of unpack this just a little bit. It's designed to support EMS. If you read the
Mhm.
notice of funding opportunity, we are in the scoring that states get. If they have EMS in their program, they get extra points. Just newsflash EMS. We have another opportunity where it is recognized that the EMS community does more than transportation and
Mhm.
more than the delivery of emergency medical services. So let's talk a little bit about this very candidly, Victoria, is what does the industry need to do? This isn't like something they can submit for themselves. This is not ET3. This is not like you are submitting an application for approval for your own agency. This is going through a state. There's only 50 states. And so those are the ones that are going to apply, and they're either going to get approval or not. And it's over a 5-year period. So technically, it's a short term thing. And then you got to talk about long term sustainability. There's a lot that go into this. And so when you hear this and we're having this conversation, you're about a month from the deadline that is required for states to submit their application. So if you're hearing this for the first time, you're probably a little bit behind the 8 ball. But if not, what are some things that EMS can be doing? What should they be doing, in your opinion?
Yeah, I would agree with you. In the time frame of when this is being heard, it will be even more crucial to make sure that you're getting dialed in. Some of the conversations we're having still are focused around, do you even know who's leading the charge for your state for getting the application in, and making sure that we're supporting wherever we can for getting, professionals in this space connected in with the state partners that are going to be able to submit the application and really ensure that EMS is a core part of that. So whether it's EMS innovation, whether it is, MIH and CP, or some blend of both, which is where a lot of these states that are ahead of the game, where we're seeing some focuses there. We're seeing EMS initiatives, we're seeing workforce development, we're seeing technology engagement and utilization of technology and a focus on that as part of EMS and MIH and CP. And we're also seeing a big focus on sustainability as part of the plan. So you want to be as proactive as you can about building in the sustainability elements so that we're not recycling this pattern that we have gotten ourselves stuck into of, well, let's try this pilot and then not ever have a plan for getting ourselves out of pilot mode. So incorporating sustainability into part of the plan is going to be really important. But, we have states that, well, all the states to some degree, right? We have these states and we have these healthcare agencies that are going to have to do more with less. And they may not even be well positioned to best elucidate or be able to effectively communicate how and where EMS and MIH and CP can be just wildly useful. So you've got to, call them up on the lunch break, go them down to the office, whatever it takes to make sure that you're able to support your state in effective communication of what those implementation opportunities are, technology opportunities, sustainability opportunities for building into that plan.
And here's a few things that I would suggest if people are listening today, because that is one thing that they're thinking we've not been involved, or maybe our local state association, because these are state run initiatives, and you're a
Mhm.
national association, so you're providing support. And so we'll talk about this at the end, that people may say, well, how do I get and be a part of your association? I want you to kind of talk about that too at the end, because I know I'm going to ask some stuff about that because people are going to be interested in that. But the one thing that I'm saying is also you've got to think outside the box. There may be things that you got to plug and play into. So I might need to be a subcontractor to someone else that provides some. You may not be the prime in this piece of it if you've not already been in the dialogue. It may be somewhere, but the one thing is, states need to demonstrate. They get extra point, which what that means is there's extra money available to the states through this funding opportunity if they can demonstrate how EMS is being used to transform care, increase the quality. There's evaluation mode through the process, and you put all that together, they get extra money for that. That's key for people to understand. And so you need to be able to say, hey, wait a minute, I might be in a state, we've not been at the table, but I've got excellent relationships with my hospital association. And so I'm going to work with those conduits that maybe I'm going to work underneath them, or I'm going to work underneath someone else as well. So don't allow the hero mentality of who we are as EMS to say, well, I don't want to work around that. You need to understand, because some of this is great policy and then politics gets involved. And so understanding when I need to guide and when I need to be the hero is going to be really important through this process.
Mm-hmm.
Anything to add on that, Victoria?
No, I mean, I think that you are spot on. I would echo, everything that you have summarized. The only piece I would say that we haven't mentioned yet that is likely highly relevant, is also another challenge potentially in the EMS space is, working on really how to communicate and look at things from a value-based care lens, because we are seeing an increased focus and need to focus on presenting strategies that uphold value-based care.
And I think that's a part of what we've got to talk about. And what are those elements? And so I was talking to a colleague earlier this week as well, because the devil's always in the detail. And we generally sometimes talk at macro levels, and the states have to develop the micro levels of everything. And so where is the detail? What does that look like? And how many core elements should you look at? I'm strongly suggesting as you work through this process, you look at one or two elements. And what is that in the entire cost containment center piece of it? Dr. Beck and I explored that on his on our last podcast, and that was just relative to, okay, we know strokes are a high concentration of this administration. We understand the cost that go downstream relative to that. Though it's a low utilization on the EMS side, that might be another good area to do some valuation around, because what we do have data on is that 53% of transports that occur that go to hospitals, we can see in the longitudinal record, they're misdiagnosed. We treat them for something totally different, but they were strokes. It could have been like a fall. It was actually a stroke, but we treated the fall, not other symptoms related to it. So those are some things that we can do. And then a lot of focused concentration on, of course, what a lot of us talk about is the high utilizers, low acuity calls. Those are really, really easy to work through the system, and that can be done through a myriad of things. I'm doing another podcast as well with an entity that's been really involved in doing these nurse navigation things, just getting people's minds into different ideas of even getting the people out of the system. There's ways to do things like that. So I'm just encouraging the industry to begin to think outside of the box. Don't let great be the enemy of good. And as you know, because sometimes we all get there, we all get passionate about our projects, and what happens is we wind up getting nothing done because we got passionate about wanting it to be perfect when, let's just get 70% of the way there, 80% of the way there. So I know we've been talking a while, and so I'm enjoying this conversation, really understanding what's happening. What I really like to talk about as we're kind of winding down on this podcast is crystal balls. I'd really like to talk about when people such as your acumen come in here, and if we had everything, if we didn't have to deal with politics, if we didn't have to do with regulations, we didn't have to do with anything, and we had our crystal ball, and there was one or two things that we could just make happen. What would that be for you, Victoria, in this space?
Yeah, this is hard, right? We have to narrow it down to one thing.
Well, if you
Isn't the
got
genie
two,
supposed to give?
okay.
No. I was gonna say to you, Asbel, shouldn't the genie give 3 wishes? Isn't that what we're supposed to
Go
do?
for you, Victoria,
No,
we'll allow it.
no. So, if you don't mind, I'd like to share a story because when I think about this, I think about an experience that I had, and it's a personal story, but I'm gonna share it really briefly if that's okay.
Please.
Uh, I was on vacation with my family, and at this time, I have 2 daughters. That's my most important job, mom of 2, and I'm on vacation with my family. We're actually with a large group of friends and family, and we're in the mountains up in Georgia. And I'm not going to be specific about exactly where we are, and you might understand why in a second. But it's early morning hours, 5 a.m. ish or so, and the smoke alarms go off. And sure enough, our rental beautiful cabin on the lake, it's on fire. It is a full-blown house fire. And so we're able to get everyone out, fortunately, even though it was a multi-story house, and we're outside, and I, of course, call 911, and I'm on the phone with 911, and I'm giving the address, which I couldn't even believe I had, right? Being a vacation home. And she says to me, the dispatcher says, well, that's right on the county line. Are you, and I'm going to use examples, are you, Johns County or Smith County? And I said, oh, gosh, I have no idea, right? I'm here on vacation. I have no idea. And then, I'm getting the kids away and everybody, there's a lot happening, right? As we're getting everybody away from the building, and I hand the phone off to somebody else. And I remember being so afraid. Well, hopefully they send them. Like, what if neither county responds, right? And in Asbel, of course, here comes this fire truck. And then immediately down the lane here from the other side, right? Here comes the other county. Okay. So we've got emergency response coming from both counties, likely more than was necessary. And what I realized is that, when communities are in need, EMS, fire, our first responder groups in emergency medical services, they show up. They show up, even if they're not even sure it's their county that needs support, right? And it just was such a moment of clarity for me that I was afraid nobody would come. And yet both counties sent full response. And that would be my crystal ball moment, I think, is if I could make one thing apparent across the space of healthcare. We have rural hospitals. We've got provider groups. You have, FQHCs. You name the healthcare group that goes out there and tries their best every day to take care of patients. While simultaneously somehow making sure they have a bottom line and are able to stay afloat despite rising costs and lowered revenue, right? And these communities are in need. Their communities are going to be, we're going to have increased utilization. We're going to have the gaps in care are going to increase. We're going to have those EDs that are overrun, increase in 911 calls, and we're going to have poor health outcomes. Our communities are in need. And I want the healthcare providers to know you guys can call 911. You have got this resource, this national resource that is available to you. And that's what we do in EMS. That's what they do, is they show up when the community is in need. And for more than ever before, no matter what role you're in, you're C-suite, you're, charge nurse, you're running an ER, you're running, an FQHC, whatever your role is in healthcare, you're about to have to do more with less, more so than ever before, potentially. And it would be really nice if you had a Swiss Army knife that you could help to deploy to your community in need. And the rest of it can be figured out. So if your challenge or your heartburn around this is, well, I don't know how we would operationalize MIH and CP for our community, or, I don't know how that intersects with scope of care and or how do we figure out the funding model so that we can get it sustainable across our entire state? Sure, every one of you is going to have a unique challenge to figure it out, but that's what we do. In Asbel, I just spent time talking about how NAMIHP stands for empowerment, and we collaborate on a regular basis, and we're agile to be able to give perspective around what your unique needs are to implement this. And we're able to support you and get you connected with people that can help you figure it out. So that would be my crystal ball, if I could, is help the rest of healthcare recognize that they can call 911. You have this resource that will come and will help you and will respond. They'll be your Swiss Army knife. They'll help you do more with less.
What a great story. What a really, I'm just sitting here listening as you tell that story, adapting and innovating. And I'm going to kind of leave it there, and we're going to just make mention one thing because it's a very important week. But change is coming, whether you like it or not. Everybody adapts to change differently. And so taking you along that process, it's okay to be fearful of change, but change in healthcare is coming if you haven't already seen it. And you have an option. You've got one is to try to dig in and just say, I'm going to try to avoid the change and make it through the change. Or you can say, I'm going to adapt and innovate. As they say, adjust the sails. You may not be able to beat the storm, but you adjust the sails. And so that's what I'm suggesting mobile integrated health is in EMS. We're adjusting the sails. So let's talk about this week as we end here. And I want to say thank you, Victoria, but talk to the audience that's listening today, because it's a really special week this week in this space as well. So excited about that.
It is. Yes, it is National MIH Week. And again, 2 years ago, 3 years ago, that wasn't a thing, right? A decade ago, that wasn't a thing. But we have grown so much over the last 5 years or so in this space that now we have a National Mobile Integrated Healthcare Week. We've had a couple different states that have led the charge, recognized this across their state and at the governor level.
I saw it in Texas, right? I saw it. Did Governor Abbott recognize this?
Yes, he did. We are so excited to see that from Texas. We've also seen a few additional states, Massachusetts, Rhode Island, South Carolina, Kansas, Wyoming. A lot of really key players that have already started to recognize just the immense value of MIH and CP. And we've had a lot of forward momentum around MIH Week. So again, if you're into empowerment in this space and you want to celebrate MIH Week, recognize or acknowledge the champions that are out doing this work, we've got a way to help you showcase that. If you are wanting to get involved in the advocacy lens, we have a way and resources for different projects that we've been working on in the advocacy space to keep you informed in legislation and make sure that you have the opportunity to get involved. And then lastly, our call would be go to our website. We'll get the details posted here. Join us. There's impact to be made if you are wanting to get involved across any of these lenses that we've talked about, whether it's rural health transformation, whether it's MIH Week, whether it's research and evidence-based medicine and contributing to those projects. We've got a place for you. That's what we do. We bring everybody in and help to support all of our peer orgs in this space to really make sure that we're serving into upholding and representing the value of MIH and CP nationally.
Well, Victoria, I can't say thank you enough for coming on to the Leadership Lab. Your energy is noted. Your passion for mobile integrated health is noted. And thank you for all that you're doing in this space.
Thank you so much for having me.